Respiratory season is upon us, and we're going to be talking about how you can prevent getting sick. I'm Rob Freelove, Chief Medical Officer and Senior Vice President at Salina Regional Health Center.
Dr. Freelove, thank you so much for coming on the show. It has been a while since we've talked about COVID and respiratory illnesses, but it really is that time of year. Is this kind of the new normal now that we're going to be dealing with this every year?
Yeah, I think so. I mean, we had it before COVID, influenza, RSV, those things. Those never went away completely. They're still there, and now COVID's just part of that. So really, it's respiratory illness season. This is what we've seen years before, where winter we kind of have an increase in cases. We're seeing that right now. Certainly locally, we've seen a lot more COVID, RSV, influenza, and then undetermined, but respiratory viral illness.
So it's probably a good time to talk about the prevention things that we all learned in kindergarten, but to talk about them a little bit, right?
Right, sure. And they were emphasized so much in 2020, obviously, when COVID was first hit the world, and that was the year we saw no respiratory illness in the winter because everybody was doing the right things. So good hand washing, not touching your face. If you are sick or you're around people who you think might be sick, wearing a mask is really important. And if you do get sick, stay home. Get tested. It is good to know what it is because like I said, you quarantine a little bit differently depending on what you have. And there are treatment options out there as well, especially for people who are at higher risk of severe disease from both COVID and influenza. There are some treatment options, but you gotta do them early or they're really ineffective. It's never too late to get vaccinated for any of those. There was a new COVID booster this fall that came out that's more consistent with the strains we're seeing in the country. Influenza, same thing, the flu shot this year. Those, like I said, you can get vaccinated any time during flu season or respiratory illness season. It doesn't have to be October, November. Generally takes about a couple weeks before they're effective, but now if you didn't get vaccinated sooner, it's not too late now. And there's a new RSV vaccine out there as well. So I encourage people to get vaccinated, to talk to your healthcare provider about what you might be eligible to receive as far as like the RSV vaccine, but doesn't necessarily mean you won't get it, but does mean that if you do, you're much less likely to get severely ill.
Okay, thank you so much for some great information, and thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.